Hi, Joel here. So what do you say? Should health insurance divide us or should it unite us? We've seen two types, the main two types, state-sponsored and employer-based or employer-sponsored. And we've seen that they have good sides and they have less good sides and they have things in common. Both of them can lead to poverty cycles. And the other one is that they do not help gig workers who do not want to work on the black market. So there's place for improvement. And United States not having a general plan means that we have the foresight of all other nations' mistake and we can do something much, much better. That's the perspective of this series of videos. The discussion so far I've heard is between single payer or no single payer. But I don't think, looking at what we've seen before, that this is the main issue. The main issue, in my opinion, is whether people can accumulate a cash value. So in a sense, we have right now everywhere term health insurance. It's basically different flavors of the same ice cream. What we need, I believe, and what we're moving towards in the employer side of things is a whole health insurance where you actually can accumulate some cash value. So if you're not sick for 40 years, you have a little bit of spare money. If you haven't been sick in 80 years, well, you have more money available. And if that money is transferable to your beneficiary, well, you're going to try to save some because, the grandkids might actually need some surgery at one point. Kids tend to be hurt, to do silly things. And so this trip to the emergency is not unusual. And so that I think is the big question is, do we have um, term or whole health insurance? And the difference between terms and whole insurances is typically in the way we pay things, that in terms insurance, the premiums start low and they keep increasing more than linear. And those term policy that have a cash value, that cash value is used to curb the premium to be fairly stable until it's time to cash out or the policy run out. So the next video, we're going to talk about interest. Who has an interest in our health? Who loses money if we're unhealthy? And the other one is, what kind of perils do we have for our health? So if we look at basic principles and basic value, quantities, then we can actually come up with better plans. So that's that. 3 minutes 45. Take care. Bye.